Thank you all for coming this afternoon, this evening, depending on where you are, for session 2 of the East Transition to Practice course. The focus of this session is going to be mastering the job hunt and a little bit about contract negotiation. Uh, sure. My name is Avi Bhavaraju. I'm an associate professor at Morehouse at Emory Schools of Medicine. I'm a surgical intensivist at Grady Hospital. We've got a great lineup today. Besides myself, Dr. Konstantin Khariton, professor of surgery at Weill Cornell. He's also the associate PD at the New York Presbyterian Queens Hospital. And Dr. Smith will be joining us a little bit later. I'm sure most of you all know. Wears a lot of hats, holds a lot of titles. Our immediate past president of East. Most recently was named the interim CEO of U of L Health, amongst many other things. So just a brief catch up. This is our second session. I just wanted to do a brief recap for those of you who may not be able to attend the first session. TTP, as we call it, is a transition to practice course. It's a 4-part series, each about 60 to 90 minutes. First session was back in June. We talked about sort of what TTP is, why we're doing it, some billing and coding basics, a little bit about the business of acute care surgery, different practice types. Today we're going to focus more on job searching and contract negotiation. Third session will be in the fall. We're going to sort of talk about all things insurance related. And then our fourth session towards the end of the year will be all about retirement, financial planning, and sort of adverse events. Format's going to be brief presentations. We're going to, I'll do our best to keep us on track in terms of time, because I know a Q&A part for this is really important. So we built in a significant amount of time just for that to answer your concerns or questions. And I think another key thing that will sort of distinguish this from other courses or things you may have taken is we really want to provide ongoing follow-up, ongoing advice and resources to help you as you make this transition. So why do we need it? Well, after a lot of sort of talking and experience with a lot of people, what we've realized is that, in traditional GME, there's a lot of focus on the medicine, the surgery technique, like how to be a good doctor, how to be a good surgeon, which is all important. But there's really a very little effort or focus put on how to actually successfully enter the workforce. And I mean that not just professionally, but also personally. How do you make that transition in your life from trainee to now surgeon or physician in any particular field? And I think this really stems from a lack of systemic education about things like how to actually find a job, how to critically evaluate opportunities, how do you approach contract negotiation, right? The focus of this session. But more than that, really, it's about how to advocate for yourself. How do you realize and understand that you're a valuable person and you have value and you have worth? And how do you advocate for yourself when you're in a job search? Because there is a negotiation involved. Understanding some of the basics of the business of medicine and surgery, right? If you were like me when I was at this level, like, I don't care, it doesn't matter to me. But that's a very narrow perspective. And to be honest, in healthcare in 2025, there are at least some very basic concepts and understandings that you should know about to help protect yourself moving forward, or you will get taken advantage of, or could end up in a very bad situation because you don't know some of these things. So I'm not trying to make you experts, it's just give you some basic understanding of how the business of medicine works. But also, I think more importantly, is how to actually successfully enter practice and to set yourself up for long-term success. And we mean that not just professionally, but also personally, because I think it's very short-sighted to think that your long-term well-being and satisfaction in the job is only tied to the job, right? A lot of this has to do with your personal life and your personal levels of satisfaction. They sort of very much interplay to each other. And then really, I think the biggest thing is to focus the job search and your career development on what you truly want, right? Introspectively asking yourself hard questions, difficult questions, not so much about what you think you should be doing or what you were told you should do, but what you truly want and what brings you happiness, contentment, and fulfillment, both personally and professionally. So our goals for the course overall is really to educate, empower, and advocate. Because at the end of the day, knowledge is power, and lack of knowledge leads to disempowerment and leads to increased risk. Risk in terms of job dissatisfaction, job turnover, unhappiness. And at its core, it's really about advocacy for yourselves and for your colleagues. But it's also about networking and relationships and helping you build a team to help you succeed and get you where you want to go in life. And that is really not meant to be just professionally, not just attaining titles or positions, but overall success in your personal and professional lives. And, as Dr. Salina Wydo, who was sort of my co-sponsor for this course, when we were sort of coming up with the course and discussing formats last year, she had this line that I stole from her is, is really to free you from the shackles of expectations, both your own expectations, those of expectations of your family, your friends, your colleagues, your mentors, your program directors. It really should come down to what you want and what drives you and what you're passionate about, and helping you frame your career, your job search, your transition into practice through that lens. And also, I think in terms of the advocacy piece is spreading the word. We are using East as the vehicle to get this out there, but it's really relevant to all GME trainees across every institution, every program in the country. It's not just for surgery. It's not just for trauma and acute care surgery. Thankfully, through our involvement with East, we were able to use East as a vehicle to bring this to you guys. But I hope that you'll spread the word to your other colleagues and your other friends. And ultimately, my goal would be to get this to every GME program and every trainee across the country eventually, because it's relevant to everybody. Oops, sorry. So with that, I'll turn it over to you, Dr. Konstantin Khariton, who's going to sort of talk initially about where should I start the job search process.
All right, thank you, Avi. Let me just switch over. Now I'm having issues, which I didn't have before. All right. That seems to be sharing. All right, I'm Konstantin Khariton. Navi was way too kind. I am an assistant professor of surgery. I haven't skipped a few grades there. And I'm going to talk to you guys about the application process. And this is going to not work. Naturally, it's all these things. All right, give me 1 second. All right. So I'm going to cut to the chase. I think Avi made some really great points, and some of them are going to be a touch redundant in my part of the presentation. I think if you tune out for everything else I say, this slide is probably the most important slide. In case these slides get shared later, I left a lot of information on there. So if you missed it, didn't pay attention, you could at least use some of this as a framework for setting yourself up for a job search. So all the stuff we present is anecdotal. It's our experience of colleagues, experience of friends, and things we've gathered over years of practice. I think the number one thing is do not make decisions based on money when you look into jobs. We're all going to get paid. Yes, there's going to be some better deals, some worse deals, but you're going to spend an inordinate amount of time in this job. Finding the job that makes you happy in what you're doing is much more important than some difference in money. And once you find that job, then you can negotiate and make sure and get your worth. But don't decide just on money alone. And that's what not to decide on. What you should use, especially for first job, the number one thing is to find mentorship and supportive partners. It's a big curve. It's a steep curve going to being an attending and taking on all that responsibility and developing a long-standing career that's going to bring you satisfaction. So having mentors and supportive partners is probably the most important thing, especially for a first job. And those two are not necessarily the same. Mentorship is guidance. Support is having people in your corner when you need them. They could be one person, that could be the same person or different people in your life. When you go out in the job search, remember everyone is selling you something. Everyone's going to put their best foot forward, just like you are. So everything you hear about a program when you do an interview, when you're researching, take it with a grain of salt. Ask around, ask your friends, ask your colleagues, get the inside scoop so you know exactly what you're getting into. If you're seeing a lot of turnover, that should be a red flag. It doesn't mean it doesn't necessarily rule out a program, but you have to dig into it deeper. Meaning if there was some malignant thing there that has changed and they're restarting, that may be a good fit for you. Whereas if the problem hasn't left, then this may not be a good fit and a healthy environment to start your first job in. Ask the people who left, but remember, they left for a reason, so everything they say you should also take with a grain of salt. Look for growth opportunities. Try to think, and we're going to get into it in a second, but think about what you want in your future as far as professional growth and see if there is those opportunities there for you. If you want to be a SICU director and they just filled that position, And that is really important for your future growth. That may not be the position, that may not be the job for you. So make sure you look out not only for what the job entails, whether you're doing trauma or you have enough EGS, but that you have other opportunities. Because after a while, all those operative things will become routine and you're going to look for growth elsewhere. And remember, when you're interviewing, when you're going through this process, surgery is a small world. Be courteous to people, be kind to people, be respectful. Don't allow people to use you, but at the same time, do not use others, because mistreating the people you work with will come back to haunt you. And that even starts at a professional level right now. Be kind to your junior residents, be kind to the medical students. They will be in the field soon, and they will remember the unkindness with which you treated them, and that may backfire some point in the future. So it's overwhelming. I remember when I was doing my first job search, you need a framework. You need to have a way to organize your thoughts and your plan to make this giant opportunity and this huge process a much more contained and cohesive environment. So where do you start? First, make a CV. If you don't have a CV, this is the time to start. Proofread your CV. Make sure somebody looks at your CV. Mistakes in your CV just look terrible. And then you have your CV, you have all that set up. Then you have to sit down and you have to think about what you actually want. Take a pad and paper. I'm kind of old school. I literally will take a journal and sit down and be truly introspective yourself. Ask yourself the big picture questions. How do I picture my life in 10 years? And that doesn't mean what my professional goals are. That means, what is my life goals? Do I want to, what are my professional aspirations, but also what is my work-life balance? Do I want to make sure I'm spending time with my children? Is that my priority? Everybody's big picture is different, and you have to be honest with yourself about your big picture. You have to think about what truly makes you happy. Now, what people expect of you, you went to some really fancy programs, so you're expected to be a fancy academic. That may not be you. The expectations of where you came from that others put on you should not affect this decision. You have to look introspectively and decide what you want. Jot those ideas down so you have some idea of your big picture plan. And then you could start defining your framework. So the first step of your framework is to define what you need. These are absolute deal breakers. If you have a spouse that lives in the same area, has a job in there and you cannot move, or you have family that you have obligations to, you're geographically confined. Figure those things out. It could be a lifestyle thing. It could be a job requirement. Maybe you're a huge trauma junkie and you absolutely need that high volume trauma center. Well, there's not that many to go around, so you may be confined to those centers. Whatever it is that is an absolute need, if this job will not be satisfactory to you without it, you have to put that on paper, and everything that does not meet those deal breakers has to be eliminated. This will narrow your search, for some of you a lot more than others. Then you get to the things that have a little more flexibility. The next step is think about the actual job. So what do you want in the job? What are your priorities? Where are you flexible? What are your clinical interests? Every trauma job is going to be some mix of trauma, emergency general surgery, acute care surgery, and surgical ICU. Which one of those is the most important to you? Are you a trauma junkie where you really need to be at a place that's high volume trauma? Do you really love ICU care and want to be in a place that has multiple opportunities like ECMO and covering neurocrit and so on? Figure out which one of those are most important so you have an idea of what the job you're looking for looks like. Think about what the non-clinical aspects of the job are. So are you a big research person? You need to make sure they have a lab. Do you want leadership opportunities? Do you want to train residents? Do you want to be academic, or are you okay being in a community center? You have to decide which of those are part of that big picture plan that you imagined in the previous slide and prioritize those. And then you look at the extras. Do you want to do robotics? Do you want to do burn, global surgery, surgical innovation? If those are important, then you have to figure out how important they are and where they weigh in. now you have kind of you should have a grasp of what your job should look like. And then you look at what your life wants are. Do I want to be rural? Do I need to be in an urban setting? How important is my compensation? Because compensation does play a part. Do I want to live if I want to be in the Northeast, I may need to sacrifice on the compensation a little bit. If I want to go somewhere rural, I'll get a little bit more money. And what is your work-life balance, right? Because before we were all just workhorses and we put in a ton of, and it was just work, work, work. But the industry is changing and the expectations are changing, and it is much more acceptable to want to have a reasonable work-life balance to prevent the burnout that I think a lot of us feel. So figure out how important is that and what does that look like for you? Is it a schedule that gives you weekends off? Is it flexible partners? Is it a certain amount of vacation? Is it your call obligation? Do you want to have a limited number of calls? Do you want to avoid in-house call? Is there a remote option for when you're non-clinical, or are you expected to be in the hospital? What does that look like? And all these things, as you go through them, you prioritize them, you jot them down, you create a spreadsheet if you're capable of that, or write it on a big piece of paper. It doesn't matter. Put it in your journal, but have an idea, have a framework, and use these questions to kind of form that framework. Now that that's done, then you have to create priorities. So you look at the framework you just made and you say, all right, between work-life balance, clinical, location, finance, and mentorship, which are my most important? And you order them. Once that's done, now you have an idea of what you want, what it looks like, and which of those things are the most important and which things are less important that you're willing to sacrifice. Now you're ready to look what's out there. Now, one of two things that's going to happen. If in step one you had you had very specific deal breakers, your job search may become very, very limited. I was limited to New York City when I came out of training. My job search was I want to do trauma and I want to be in New York City. There's like 12 hospitals and one of them has a posting. So if you're in a very limited field, you're going to go and look at what all the jobs that are out there, whether they're available or not, and prepare that way. If you're in a really broad field, then you're actually going to look what's posted and available, and then look at those jobs instead of trying to look at every job in the nation, and then match them to your steps 3 through 4. I'm sorry, 2 through 4. Write a letter of interest, especially if you're in that narrow group, because you might be sending your CV to people who have been advertised. So you definitely need a letter of interest with having it read by a trusted advisor and advised and edited before you're sending. Now you're ready to look. So there's a few ways to look for jobs. The most common is there's word of mouth, talk to friends, colleagues, mentors, your PD, friends, and a lot of jobs will actually be found that way because somebody's been interviewing, oh, I heard there's a job here or there. Go to the East Assembly or other professional meetings. Networking at those assemblies is a really, really great way to find out about jobs that are just coming on, may have not been posted yet, and give you a step up on and you also meet the people who are posting them, and you can have sort of a pre-interview where you get a little vibe of how you get along with these people, whether they're your kind of people, and gives you a sense. The other options, the traditional options, online resources you could see listed. You can call people. So if you're in a really small area, there's 6 hospitals, you send them your CV, and this is where you go to your friends, mentors, advisors, and say, hey, do you know so-and-so? It's a small world. Somebody knows somebody almost always. Can you call them? Can you ask them to talk, put in a good word, find out if there's a job that's coming up. And then there's recruiters. So now that you kind of figure out what the lay of the land is, the next step is start applying. If you apply through the online links through all the job boards, be prepared to be frustrated. It's a lot of back and forth, a lot of submitting documents, creating CVs, and things of that nature. Once you've started submitting, create a master list so that you can keep track of where you applied, who responded to you. If you're sending out to programs that are not listed in hopes that either they're soon going to have an opening or they will consider you at some point in the future, make sure you send your CV, address it to their chair, and have your mentors or faculty speak on your behalf. Once you've sent them out, Make sure send follow-ups, and make phone calls. Do not be too pushy, but also be and persistent, but at the same time, make sure you follow up, show that you're interested, show that you're truly invested. Keep track of your correspondence and be very methodical about this. And then follow up with the programs just to see where the process is going. It's very important to show you're present, but also not to be pushy because people are going to work at different paces. And then you're going to get some interviews, and Avi's going to talk to you about what to do once you get some interviews. So I'm going to tag him in now.
Thank you, sir. All right. All right, is that coming through okay?
Yep, perfect.
All right, so we've kind of set up, right? You've done your soul searching, you've made your list, you've sent your letters of interest out. So now what? I mean, interviewing, right? So again, this is all anecdotal. This is experiential based on my experience, the experience of the people involved in the East Mentoring Committee, and those specifically involved in putting this course together. I would advocate that you should schedule as many interviews as you possibly can stomach and actually schedule. There's no downside, right? The cost is not a factor in this situation because they're going to pay for everything, right? So it's really just time and your willingness to do it. But having said that, always, and Dr. Khariton made this point, is always be professional, always be courteous, show interest, right? Be assertive. This is not the time to be passive or reserved. You want to be interested, be engaged, but also be a little bit forceful in the sense that you want to get information about the program. You want to know about the situation you're walking into, right? Remember, you were interviewing them as much as they're interviewing you, right? They should woo you. They should pursue you. They should make you feel wanted. Remember, in this situation, contrary to every other time you've been interviewing for a job, you're in the power position now, not the other way around, right? They need you far more than you need them. Remember that, right? Particularly in acute care surgery, you can find a job almost anywhere in this country. There are far more jobs available than there are positions and surgeons to fill them. That gives you leverage, right? That gives you power. Keep that in mind. Now, don't let that get to your head. But the point here is that it's not just you asking for a job or begging for a position, like in medical school asking for residency spot, residency asking for fellowship spot. It's not, thank you, sir, I have another. Right? You have power, you have leverage. You need to remember that. You are in a person of value, and it is not easy to recruit someone with your talents and your skills. And to go along with that, you should ask a lot of questions and ask a lot of questions about everything and ask the same questions of multiple people, right? This is your best time to get as much information about the job and the culture of the organization and the culture of the group. It's all about fit, right? It's not just that are you a good fit for them, but are they a good fit for you, right? Does the group and the organization fit what you're looking for, and will they help you get where you want to go? And to do that in the happiest possible, most satisfying way. Now, nothing's going to be perfect, but a lot of this comes down to is what I would say is expectation management or expectation mismanagement. The more information you get on the front end about the situation, about the job, about the culture, when scenarios arise that are going to put you into a stress situation, if you didn't ask these questions or know ahead of time, it can oftentimes lead to a lot of disenchantment, dissatisfaction, which then leads to job turnover. So this is your time to get those. Look for consistency in answers, right? So that's why I say ask the same question to multiple people, because if you don't get consistency in answers, I would qualify this as a red flag. Doesn't mean you walk away necessarily, but go into it with caution and trepidation about what the situation is. Why are you getting inconsistent answers? And the other thing I would say is, if they get cagey, because sometimes they will, and they don't want to answer, or they make you feel bad for asking specific questions, I would also qualify this again as a red flag, right? If they don't want to be open and honest with you about things that you want to know about, or they make you feel bad for doing that, what do you think that at this situation, this is their best foot forward, as Dr. Khariton mentioned. They're trying to show you the best of them. And if they, even in that scenario, they're unwilling to answer or make you feel bad for that, what do you think is going to happen after you sign a contract when you have no leverage, right? So it's important to get this information ahead of time on the front end so you know. So now let's say you get your interview scheduled and you're going, like, what things should you know? What things you should ask about? I know when I was doing this process the first time many years ago, yeah, you think about the simple things. Oh, like, what's my salary and what's this and what's that? But there's a lot of really nuanced things to this that you should know about. So yeah, pay is important, but this is not something you're generally going to talk about during the first interview. And what I would tell you is that this is something, the very granular discussions about this are likely going to happen during a follow-up discussion or follow-up interview. So don't get too hung up on pay structure in the beginning. Having said that, it is important, right? Pay structure, salary. So that typically is going to break down into salary versus bonuses. Now, this is going to be a little bit duplicative. Dr. Khariton already mentioned this, but I would also advocate that pay should rarely, if ever, be your primary motivating factor in deciding a job, right? This strategy, although important, should not be the primary motivating factor. This strategy will almost always certainly lead to dissatisfaction and job change in the long run. So ask about it, know about it, but don't emphasize it. And again, not to be during the first interview necessarily. So what about salary? So you've got base salary, that's straightforward, everybody understands that, but there's other more nuanced discussions, RVU targets, right? So hopefully most of you know what an RVU is. We talked about that in the first session, but essentially it's the widget, the metric by which our work effort or work product is tracked. So do you have targets? I don't know if a lot of you know this, but many jobs, not all, many jobs have, if you're getting a salary, right, you've got a certain expectation of work product or work effort for a year. So do you meet that target? Do you have a target? And if you do, well, let's say if your salary expectation is X for work producing Y number of RVUs, what if you work more than that? What if you get, if your expectation is 5,000 RVUs and you've made 10,000? Well, is it defined? What is your work product for your extra work? So that's generally defined as a dollar per RVU fee fund. So is that defined? And I would advocate if it's not, you should ask for that. Like, what if I'm meeting my effort, but I'm killing it? I'm doing double what I'm supposed to do. How much am I going to be getting paid for that? And again, it's not about money, right? It really comes down to recognition of the effort that you're making and the work that you're doing and getting credit for it. The flip side of that is some jobs I've seen have penalties for not meeting RVU targets. So you may not have known this, but like some places, if your RVU target is 5,000, and let's say you hit 4,000, some places might actually downpay you, right? Take away salary or make you pay it back. So that's something important to know about and ask about. What about overtime compensation, right? So pay for the work beyond your minimum required. And this really comes down to a very sort of touchy subject or a subject that needs to be talked about more is what's the definition of FTE, right? Your full-time equivalent. How is that defined? I'm not going to spend a lot of time talking about in this session. We did a lot about that in our first session. Dr. Pat Murphy from Wisconsin has done a lot of work in this regard. So it's important to define what your full-time is, what the expectation is, so that if you're working more than that, are you being compensated, right? I was in a situation at one of my former jobs where we didn't have this defined, and we lost 3 partners inside of 6 months, and all of a sudden our full-time went from X shifts to X plus extra shifts with no additional pay because it wasn't defined. So it's important to know what that is. Is your salary guaranteed, or do you have a production-based model, or is it some kind of hybrid, right? If guaranteed, how long, right? So a lot of jobs, employed jobs in particular, will give you a salary and it's defined for, let's say, 1 year, 2 years, 3 years. But then after that, some models move to a straight production-based model. So it's basically eat what you kill. Or some have a hybrid approach where it's a base salary plus production. Now, this is not to qualify right or wrong. This is really about what's going to work for you and what do you want. So it's really asking the questions to get the information. You have to make the decision for yourself, what you're comfortable with. But if you don't know what to ask for, don't know what to ask about, and you end up in a job where this is not defined or you don't know, and all of a sudden you're being told, guess what? You only had a guaranteed salary for 1 year, figure it out on the second year, that's going to lead to a lot of dissatisfaction because of expectation mismanagement. What are the terms after the initial guarantee period? So let's say your guarantee is 2 years. What happens after 2 years? So we ask those questions. And this seems silly. A lot of you are going to laugh at this, but salary caps. I mean, there are some situations, some jobs where let's say you're killing it. You're working like a dog and you produce 2 times or 3 times the RVU expectation. Well, you'd be thinking, oh yeah, I'm getting paid for all that. Not necessarily. There are some situations, some employers, well, they'll cap your salary at XYZ amount. So again, what would you, if you didn't ask this question on the front end and you started a job and you're thinking, okay, that's great. They define my per RVU dollar target and I did 15,000 RVUs and my expectation was 5,000. I should be getting paid for a lot. And they're like, no, sorry, you're capped at 10,000 RVUs. All of a sudden you did all this extra work and all this extra effort. And again, it's not about the money. It's about remuneration for the work effort you've made, recognition of that work. So it's important to know these things. Now, I would say this is not a typical thing, but it does exist. So it's something to ask about and know about. Other part of salary or pay structure comes to bonuses. So there's all different types and flavors: sign-on bonuses, moving or relocation bonuses, the productivity incentives we kind of talked about, meeting your RVU targets or exceeding them. But there's another one that comes into play sometimes as quality metrics. So there'll be quality measures that the institution has to meet. And I've broken them down because there's different types. There's individual quality metrics, there's group metrics, there's institutional metrics. And these are, targets that you have to meet, like, your surgical infection rate is less than, pick a number, 2%, right? So meeting these targets can lead to a bonus. But keep in mind, all of these are oftentimes tied together. So you may meet your individual quality metric, but if the group doesn't meet theirs or the institution doesn't meet theirs, guess what? You may not get it. So now, whether this matters to you or not, it's irrelevant really at this point, though. But if you are told, hey, you met your individual quality metric, but then the group didn't, and you lose out on an incentive, that's going to make you unhappy. So it's important to ask these questions and know on the front end. And in terms of bonuses, there's another big one, is the terms. Like, is there a payback requirement? I'm not sure a lot of you know this or realize this, but this is very commonplace that with sign-on bonuses, with relocation bonuses, with a lot of these bonuses, particularly on the front end, if you leave before the terms of your initial contract are over, you oftentimes have to pay those back. This is 100% a reality. I went through this with my former job. I had to pay back my sign-on bonus and my relocation bonus. And I will tell you, it was not an insignificant amount of money. So I would say that to qualify and caveat you that if you take these bonuses, which, well, you don't have to, by the way, but if you do, understand what the terms are. And particularly if you're not 100% certain it's a job you're going to stay in, be ready, you may have to pay those back. What else? What about free time expectations? So this is another one of those kind of gray area, touchy subject things, but I would advocate that it's important, because is your time off truly your own? So what do I mean by that? I mean, when you're not on clinical service, are you expected to just be around, right? There is a culture in a lot of institutions and organizations that just because you're off from clinical service doesn't mean you're not allowed to be in the hospital, right? Doesn't it? Whether it's written or unwritten, there could be just an expectation you're supposed to be around. Now, I'm not saying this as a qualifier, right? You have to answer this question or ask this question for yourself. Is this important to you? I would say for me, I value my free time. I value my time away from the hospital. If the culture of the organization is that, no, it doesn't matter if you're in clinical service, if we're paying you, you have to be there, that would be a deal breaker for me. But if you don't think to ask about these things, then you'll never know. And again, it leads to expectation mismatch, which ends up leading to job satisfaction. So I think it's important to get some sense. Now, we can talk about later about how to ask some of these questions, but I think I'm just trying to give you a general idea about the playing field of things to consider and ask about. Let's talk about contract stuff. So contract duration, as I mentioned already, it can be variable. I would say most of the times, and I'm generally talking about employed positions. Usually it's between 1 year and 3 years is what I've seen most commonly. But again, more specifically, what are the terms? Like, what's the initial term of the contract versus what are the follow-up terms after the initial contract? How does that process work? If you don't ask about that, you may walk into a situation, sign a contract, not realizing that the terms after the first year, like, oh yeah, by the way, you went from salary to straight production. And you didn't realize that because you didn't think to ask or you didn't look at the contract. And also in terms of renewal. So is it an automatic renewal? The terminology is an evergreen contract, or do you have to renew it manually every year after rediscussion, renegotiating with administration? Now, whether this is positive or negative, it's really up to you to decide. I'm not qualifying that. I'm basically just saying these are the things to think about. These are the questions to ask about. What are the contract terms, right? So again, I mentioned repayment of bonuses. Is that a thing? I will tell you, in most employed jobs, it is a thing. So you should read the fine details, particularly if you take the bonuses. What are the repayment terms? This is another big one, resignation time requirements. I'm not sure if a lot of you realize this, but how much you have to give notification. You hear in the ethos, oh yeah, I give my 2 weeks notice. That doesn't apply to physician jobs, right? For us, typically, we have to give about 90 days notice for most jobs. I will tell you there are some contracts. One of my prior contracts at a former institution was 180 days. That's 6 months, right? That's a significant amount of time. So make sure you know what the notification requirements are if you decide you want to resign from your job. It's important to know those things. A couple of words about non-competes. They still do exist. I know that some of you probably have read there was some law passed last year that non-competes are no longer valid, but that's actually being litigated in the court system right now. So as of this moment, do not think they do exist. You will very oftentimes, particularly in employed jobs, have these. So knowing the specifics is important. Two components typically with these, it's going to be distance and time. The distance is variable, but I will tell you most ones that I've seen, it's usually 15 miles. But getting into the nuanced discussion, right, is it 15 miles from the main facility where you work, 15 miles from any facility where you work? And in the most prohibitive sense, I've seen some contracts. A good friend of mine had a contract that said it changed from one year to the next, and he caught it, but they didn't, if he hadn't read it very detailed, it was any facility in the system. You think about that, he ended up getting it changed because he noticed it, but any 15 miles from any facility in a hospital system, essentially, if you're even in a big urban area, negates the entire market, right? So I would qualify to you that if you see a contract like this that prohibits you from working from any distance from any facility, any hot facility in a system, is very prohibitive. This is not physician friendly. I would qualify that as a red flag. Be very cautious moving forward with those. In terms of the time component, how long? Typically, it's a year. This is about standard. But again, knowing what the non-compete says in terms of distance requirements and time requirements is important. This is another thing I added in there. Is there an option to buy out the non-compete? I wouldn't say this is typical, but it is there. It does exist. If so, what's the cost? And also for your knowledge, as you're advocating for yourself and looking at other jobs, if they really want you, will your new practice or new hospital pay out the non-compete? Or if they really want you to start early, is that an option? Again, if you don't think to know about these things, you would never ask. So I'm bringing this up so for your knowledge and your empowerment and your advocacy. What else? So general things, you may not realize this, but when you get to the attending level, the employed level, CME expenses are oftentimes covered. It's variable, but I would say 3,000 to 5,000 is the typical. Then the other expenses, the sort of extras, things to keep in mind, and these are all legitimate expenses that institutions, practices, hospitals will cover. Things like license and board exam fees, DEA registration fees, journal subscriptions, membership dues, cell phone reimbursements, for example. And this is another one I bring up because I actually experienced this myself, is meeting travel outside of CMEs. What I mean by that is CME is very straightforward. Yeah, I'm going to go to East for a year and they're going to pay for it. But what if you, let's say, have a paper accepted at AAST the same year, or Western Trauma, or wherever, or one of your trainees or a student has a paper accepted at, Southeastern, and either you've already used up your CME expenses or you haven't, but then how is this paid? Are they going to cover that? So I was in a situation with my former jobs where I had two students get papers accepted at a meeting, and they were not approved to go. And it wasn't going to come out of my CME. My CME bucket was already done. And so I paid for these students to go present out of my own pocket for them to go and for me to go. So I think it's important to ask this question is, will the department, the institution pay for travel to meetings outside of your CME if, let's say, you have a paper presented or you have a student trainee? This is important stuff to ask about because you don't want to be in a situation like me where you're paying for out of pocket if you don't have to. And so I think related to that, it's also important to ask, where are these funds getting pulled from, right? There's different buckets of money in institutions. Is that money getting pulled from your CME bucket, or is it getting pulled from another bucket, another source? Because the bottom line is it's dollar value, right? If this is getting pulled out of your CME bucket, then you're going to have less available to attend East or AAST. So again, asking about these subtle things, while maybe not necessarily make it or break it, I think these are important lessons and things to know about. Whether you ask about it or not, at least you know about these things on the front end when you're going into a job. PTO and leave time, another sometimes touchy subject. But so PTO, paid time off, how much? How much time off do you get? Another big one that I didn't realize when I first came out is PTO payouts for accrued time off. So I don't know if you guys realize this, but you accrue paid time off. That is time you're getting from the institution for the hours you put in. If you end up leaving a job, and I will tell you this is probably more on the academic side than on the private side employed jobs, but you can get a PTO payout. So let's say you've not taken any vacation for 2 years and you have 3 weeks or 6 weeks built up. When you turn your letter of resignation in, you can get a payout for that. So asking about that, is this PTO payout for accrual of time off a thing, and what the process is for that? Also very important. Leave time. So the reality here is, listen, I know you guys don't like, in your trainee mode, like, oh, I don't ever get sick. I can't get sick. I just suck it up and deal with it. Well, the reality is you don't have to do that, right? It's not the right way to do things. So everyone's human. We're all human. Things happen. It's okay to ask about this stuff, right? Your life should be defined by more than just your job and what you do, right? It's important to know these things before you accept a job, because the worst thing that could happen is you accept a job without asking these questions, and something unexpected happens, right? You get sick, your child gets sick, your parent dies, and you have this unexpected thing happen, and then you discover that there are prohibitive policies in place that limits your ability to deal with that situation when it comes up. So, I think it's important to ask these things. So what is a sick time policy? What's the sick leave policy? FMLA is another big one, right? Unexpected things happen. How do you account for that? How can you get time away from that? Another important thing to realize, some jobs, not all, within the first year out of employment, you will not get FMLA. You don't qualify. So it's important to know that. And so that also rolls then to the next issue, paid leave versus unpaid leave. Do they have a policy for that? How do they handle those situations? Parental leave policy is another big one. Do they have a defined parental leave, both maternity leave and paternity leave, right? I think in 2025, most places probably have both, but don't ever assume that. Always ask the question. If you're thinking about having children or you're pregnant right now and you're finishing your training, ask the questions ahead of time so you know. And then what's the pay structure during leave time? Is it full? Is it partial? Or is it nothing? Like, do you get no salary at all? It's important to know these things. And again, if you start asking these questions, kind of reflecting back to what I mentioned previously, if they make you feel bad for asking, or they get cagey, or they make you feel guilty, you're like, oh, why are you asking that? I would qualify that as a red flag. Like, if they're saying that to you right now, even just asking questions, what do you think happens when you take the job and sign, and all of a sudden you come up with those situations and scenarios? You think they're going to make it easy or hard? So I just would qualify that as a serious red flag. For me personally, that would absolutely be a deal breaker if they were not answering these questions openly and honestly, because life happens. Another thing to think about is CME time. Variable, but I would say most places it's 5 to 7 days. Not, again, make it or break it kind of thing, but just something to think about and ask about. Office space, so some of this may seem self-evident, but I want you to know when you're at your trainee level, you don't realize all these things, right, necessarily that are available to you, but sometimes you have to ask. So office space should be provided. The basics, desk, computer, printer, copier, but there's also some extras, things that you can ask for. For example, a second monitor, a webcam, a scanner, a mouse, trackpad, software licenses, another big one. I had to ask for Adobe Acrobat subscriptions at my last 2 jobs, or editing like Dragon dictation software. So there's all these things that you can't ask for, but here's the thing, you got to ask, right? You have no idea what they might be willing to give you if you don't ask. And a lot of these things are not necessarily big ticket items, but if you don't think to ask or don't know to ask, then you might end up suffering or buying them yourself when you don't necessarily need to. So there's some extras you can ask for. In terms of office space, is it dedicated space or is it shared space? In terms of location, do you get to decide or is it assigned to you? This may seem silly, but I had a colleague of mine who was a really good orthopedic surgeon in town, and he worked really hard, and he ended up taking over as the program director for a residency program. And when he did that, they were going to make him change his office location, and it was going to create a significant amount of drama and strife for him on the family side because his commute time was going to change significantly. And initially, they were very difficult about it. They weren't going to let him do it. And so he finally put his foot down and ended up going back to the original office. But I think it's important to ask these questions because if it had gone through, it was going to create a significant amount of distress and strife for him on the personal side with his family life. So I think it's important to ask some of these questions. Other extras and perks. Are meals included? What about parking, right? Is it free or paid? Like, for example, my current job, I paid for parking. So I paid to go to work to park. So I think some of these little things are important to know. Do they get discounts on things through the institution or organization? What about wellness activities, right? So again, I'm not saying these are all make it or break it issues. My goal here is really to just give you a flavor or an idea of the things that you can ask about that are really valid and appropriate to ask about. Benefits is something you should get before you leave. Important stuff like employer-sponsored health, vision, dental. Are you covered? Your dependents, insurance stuff, life insurance, disability insurance. All the retirement stuff, right? Do they have 401ks, 403bs, Roths, standard? I'm not going to get into the details of this. It'll be in the next session, but asking about what they have available. I think the other 2 things that are really important to mention are employer matching, right? Like at my current job, they have a 10% employer match. You should absolutely maximize those. Do they have a pension plan? Not many places have this anymore, but some places do. So asking about that stuff is important. If they don't give it to you, ask to speak to the HR person. They're the person that can provide that information. Even if they don't necessarily get it to you the first meeting or first interview, you make sure you get this stuff because these little fringe benefit things can really sometimes help make the difference between one job versus the other. Let's talk a little bit about call structure. I broke this out, ended up to like several slides because I think it's really, really important in terms of job satisfaction, particularly given what we do. It's important to ask and know how many days or shifts, whatever you're qualifying it as, per week, month, quarter, year. I purposely put that vague because different places have different structures. But what is it? What is the expectation? Right? And it really comes down to, again, this sort of FTE standard, right? What is defined as full time? If it's not specifically delineated, I would proceed with caution. I put a question mark in there. I would say that it should be the standard in 2025. And I'm not necessarily saying it is the standard, but I think given the way our field is going, I think it's really important for you guys to understand this process. Like I said earlier, Dr. Pat Murphy at Wisconsin is doing a lot of good work on this, is defining what full time is for us. Now, it's not necessarily the standard everywhere, but I think it should be, which is why I put the question mark in. And I think it's going to take trainees and people like you guys coming out and asking these questions and advocating more for yourselves to help us sort of shift the needle on that a little bit. I would say the average for most places is probably 16 to 18 12-hour shifts a month, or the 24-hour equivalent. Again, as I said, these models are different depending on where you go, but just to give you some ballpark idea about what the general standard for the most part is in most jobs. And again, it's okay to ask these questions, right? These are really important. It'll play a huge role and a huge part in your happiness, your well-being, your job satisfaction. And again, same thing again, if they make you feel bad for asking, if they make you feel guilty for asking, or make you act like, wow, you don't want to work, I just say that's a red flag, right? If that's their mindset now, when they're trying to impress you, when they're trying to put their best foot forward, what do you think it's going to look like when you actually sign on the dotted line? And by the way, now all of a sudden I'm working 24 shifts instead of 15 or 16, or you're just working more shifts than you're supposed to be working because it's not defined. So that will absolutely lead to job dissatisfaction because of, again, expectation mismanagement. Are you covering one hospital or several, right? Not just on a day-to-day basis, but on call. This is a big thing. For me, if I was covering more than one hospitals in a night, that would create a lot of stress for me. So what's the expectation? What's their structure? What's your shift distribution, right? Between services, day versus night, weekends, holidays? Are you covering multiple locations? These are all important to what's your day-to-day life going to be? What's your post-call day going to be like? What are your expectations? So having this articulated and defined in some way, I think, is important. What's the shift structure? Historically, I think a lot of us, the older of us, have kind of been through the 24-hour shift model, and you guys have all done that in training. I think that's moving farther and farther away as we kind of move farther out because of a lot of work that Dr. Murphy's doing, Dr. Coleman's doing, and it's not healthy for us. Still a lot of places that do that, but keep that in mind. So some of the models sort of shifted to, I think initially it's sort of the 7A, 7P, 6A, 6P model. I will tell you, I've seen a lot of jobs moving away from that to kind of the 7A, 4P, 7A, 5P model, so that the daytime folks can sort of spend time with their family, have dinner with their family. I bring that up because you will now realize that there's a shift hour imbalance, right? The day shift's 10 hours, the night shift's 14 hours. Well, are you as the young guy, the new guy doing a lot of night shifts, very, very heavy? Well, the shifts aren't necessarily equal one-to-one. So understanding the expectations of what the shift structure is and what the shift distribution is can absolutely lead to a lot of dissatisfaction, family home dissatisfaction, unhappiness. So knowing these things at the front end, knowing what the expectations are when you're going into it, can really help prevent a lot of dissatisfaction on the back end. How about when your shift ends? What's the expectation, right? Again, this is not always written down, but what's the soft expectation? What's the culture? Who takes over for you and when? Can you leave when your shift ends? Does your partner tag you out? Do you have that kind of collegial, friendly work environment that I tag you in one day, you tag me out the next day? Or is it, no, you're required to stay and you cover rounds or you cover clinic or you do cases? What's their culture, right? This will significantly, I promise you, will lead to a lot of dissatisfaction if you sort of have one set way of thinking in your head how it's going to be, and you get there and it's the exact opposite. It's going to create a lot of stress on your personal life. So it's important to ask those questions. What about the backup call structure? Do they even have a backup schedule? How does it work? Right? I mean, how is the backup call distributed? Are you the new guy, the young guy, so you're doing all the backups? Is it equally distributed amongst the partners? Again, it potentially leads to a lot of dissatisfaction on the personal side. But what about scheduling? Do you have any control over where you go or how often you go or who decides that? colleague of mine who took a private job, employed private job with a practice, had zero control over her schedule. The practice manager made the schedule on a week-by-week basis, and they got assigned where they went, and they were covering, I think, 7 or 10 different facilities. And on any given day or any given week, she had no idea where she was going. Now, the job was fine, but that level of not having control of her schedule led to a lot of dissatisfaction, a lot of unhappiness, because she was bouncing around different hospitals every single week. Now, whether that's a good or bad thing, it's for you to decide, but I think it's important to ask these questions on the front end so you know what the expectations are. That also kind of rolls into clinic scheduling. So depending on the model you're in, you may be doing a fair amount of clinic or not, but do you have any control over that, right? How many patients you're seeing are scheduled per day? Do you have control over that? Or is it decided by an office manager or practice manager? The time spent with each patient. You have 15-minute blocks, 30-minute blocks, 60-minute blocks. Maybe it doesn't matter as much for us on the sort of trauma side, but in the elective surgery side, like I had a good friend who's a breast surgeon, she got pigeonholed into 15-minute blocks of time, even for new patients. And for a breast surgeon, for new patients with cancer diagnoses, this created a huge amount of stress for her because she didn't have enough time to develop rapport with the patients. She ran long with every appointment. The patients got frustrated, the office manager got frustrated, and she got frustrated because she can't spend the time she wants to develop that relationship. So asking these questions, do you have control over how many patients get scheduled? Do you have control over the block times? What about if you need to cancel or reschedule patients or an entire clinic? Can you do that? And if you have to cancel it, are you expected to make it up, right? Do you have to see more patients to the next clinic because you're going to make up for the productivity? What's the expectation? I will tell you, in traditional employed models, they are business oriented and business minded. So if you cancel a clinic and you're losing that generation of RVUs, there's an expectation that you make it up. Maybe less so in private practice, but these are things to know about. What about your office hours? Do you have your own office hours? Do you see your own patients? Or is it kind of a group coverage model where you may not see your own post-ops or you see your own chronic patients? Again, it comes down to you. What do you value? Do you value having that continuity of care, or are you okay with having a group model? Yeah, I'm not qualifying this. You have to make that decision for yourselves, but I think it's important to know what's the setup, what's the culture there, so you don't have this expectation mismatch. Yeah, so I'll go quick. So a couple of things: ancillary support, important to ask about. MAs, APPs, scribes, nurses, residents. For those in academic jobs, what's the promotion pathway? What's the process? It's important to know, not so much for the titles, but this is the only way you're going to get any kind of salary increases. So knowing what that process is really important. And I'll now finish this, and we'll get into a couple of slides on contract negotiation that we'll let Dr. Smith take over. Just some general pearls of wisdom. In theory, everything's negotiable. Now, salary, bonuses, sign-ons, relocations, all that kind of stuff. But keep in mind, it comes with a draw. I mean, extras, laptops, all this stuff is definitely there. PTO, CME time, FT allocations, start dates. But you have no idea what they'll be willing to give you unless you ask, right? So it's important. Don't be afraid or embarrassed to ask for things if it's important to you. You lose nothing by asking, right? Keep in mind, they're not inclined to offer you anything more than the bare minimum, right? Their goal is to get you to sign as quickly as possible. And they're counting on your ignorance and counting on you not asking questions. They're counting on your fear so that I should ask about this or that because I'm lazy or I'm greedy. It's not about that. It's about establishing expectations and what's important to you. This is business. It's not personal. Treat it that way. Be your own advocate, right? They're not going to advocate for you. Their goal is to get you to sign as quickly as possible. But having said all this, don't overplay your hand, right? Depending on your specific desires and specific limitations, you can absolutely lose negotiating power. As Dr. Khariton mentioned, always be professional. Always, always, always be courteous. Don't ever, ever overplay your hand or be unprofessional in any way, shape, or form. A couple of the quick things. You have less ability to negotiate with academic jobs. I would say it's easier to negotiate with private practice employed jobs. That's not always. Every situation is different. But keep in mind, don't be pressured to start when they want you to. If they had their way, you would start the day after training. I strongly advise you take time off, you rest, you recuperate, enjoy the fruits of your hard work and your sacrifice, because you will never, ever, ever get this kind of free time and this kind of freedom ever again. So enjoy it. Always be professional, never act unprofessionally, and be reasonable. Like, you're not going to get $5 million a year just because you asked for it. Unreasonable asks, unreasonable requests will only hurt you and your reputation in the long run. As Dr. Khariton mentioned, this is a small world. And if you develop that reputation, it will absolutely follow you around, and you do not want that. Couple quick things. Always have your contract reviewed. Contract attorney with specific experience in physician employment contracts will be the ideal, but professionals with health administration backgrounds can also do this. The last person who reviewed my contract was an MHA background. Never ever sign a contract without reviewing it first. Letters of intent are just that. It's a letter of intent. It's not a firm commitment or obligation, so it's okay to sign those. It's not a true contract or obligation. And remember, this is a negotiation. You do not have to accept the first offer on anything. There's give and take. Be your own advocate, leverage your resources. Don't have to take anything at first offer. Things not to do: don't be unprofessional, don't be unreasonable, don't make demands, don't be inflexible. This is a negotiation, involves give and take, and don't ask for extras or things that aren't important to you. If you don't care about a laptop, don't haggle over that, right? Focus on things that matter to you. Don't focus on the things that don't. All right, now I will turn over to Dr. Smith. I apologize.
Well, folks, we've only got about 5 minutes left, so I'm not going to go into my presentation or go through some of the stuff. So, first of all, I want to tell y'all it's great to see Avi and Konstantin do this. I think, this is something that in particular provides a lot of information to folks coming out and giving you, an understanding of kind of the fundamentals. And, you've just had a massive dump of information, and it's been great to see this. One thing I will tell you all is as you enter into negotiations, I think, we're often primed to look at negotiations as a win-lose scenario. And very few times will you ever be in an actual win-lose negotiation environment. In general, all of the things that we've talked through, you've heard about today, are win-win scenarios. If we find the right match, then that's the best thing for us, as a healthcare system. It's the best things for us as physicians, right? So you've heard a lot of great things about asking the question so that you can understand your position and why you are negotiating for these things. And keep that in mind because, no one wants to bring someone in and have them leave within a few years. It's a massive expense to the organization. It doesn't do well for them. It doesn't do well for you. The job is we want this to bring folks in. We want it to last. And what I find is that most of the times when I'm negotiating with folks, you have to remind them we're here. I want to be transparent. I want to be open, and I want to give them the opportunity to make sure that this fits for them because I want them to have their whole career here. Now, that's probably, a pipe dream for most folks. They're going to move around and take different jobs over the course of their career. There's very few of us that, just stick in one place for 20 plus years. But going into it with the mindset that I have a great opportunity and they're looking to try and find that right match too, will really set you up for being able to ask those questions and be free about it. So I'll stop there. We've got about 3 minutes left. I just want to say, great talks. Questions? I mean, I guess, Avi, that's a question. Do you want to have questions?
Yeah, I mean, we got a 20 to 30 minute built-in period for Q&A. So, I mean, if you have some things you want to mention, Dr. Smith, we've got plenty of time, and we still got 30 minutes left in the session. Otherwise, we can move forward with the Q&A.
Well, no, yeah. Why don't we move forward to Q&A? Because I apologize. I've got to head out here in about 15 minutes. So why don't we do that?
Yeah. So we can. One thing I'm just going to quickly share, just very briefly, just to kind of close the loop on the contract negotiation piece. Let me see if I can share this slide real quick. Sorry. Because there are some online resources available. So I just wanted to briefly show this to everybody. There's online. I've never used any of these, so this is not necessarily an endorsement, just making you guys aware in terms of contract negotiation or contract review. Contract Diagnostics, Contracts RX, and Resolve are 3 companies that are, very commonly do these sorts of things. Also reaching out to mentors, faculty, friends for referrals. And also reaching out to us, through our experiences, through many years and many jobs, we've met people, attorneys, and people that we can put you in contact with. So if you don't have anybody, don't feel like you're out there without any resources. We can help. There's online resources. Feel free to reach out and ask, and we're happy to help with any of those things. And with that, like I said, we'll kind of capture Dr. Smith's time while he's here. If there's any, we'll open the Q&A session for anyone that's got any. Please feel free to chime in or raise your hand or whatever works best. It's an open forum.
Hi, everyone. Thank you so much for this presentation. It was great. I'm actually a fifth-year plastic surgery resident, and I was wondering about the contract lawyers. Should I be getting one that's plastic surgery specific, or anyone who's kind of done a surgical contract in the past? What do you think?
I think so. I think either way is fine. I would say it kind of also depends. I think in general terms, an attorney or somebody with physician employment contract experience in general is fine. I would suggest that, if you're thinking about joining, let's say, a private practice, the model may be a little bit different, and somebody who's had experience with negotiating plastic surgery physician contracts may be ideal. But I think the most important takeaway is have somebody look at it, right? It doesn't really matter. Somebody with experience, I shouldn't say just anybody, but whether it's a contract attorney or not, whether it's somebody specific with physician, plastic surgery contracts, that's the ideal, but it may be hard to find those. I'll tell you, like the last time, my last two contracts, it wasn't actually even an attorney who reviewed my contract. It was a contact that I met through a friend who's actually a health administration background. And I found him to be even more helpful than an attorney would be, because his perspective was not just the legalese, but he was able to provide qualifier because he's got a lot of experience looking at physician contracts and also employer contracts. So he was able to give me a perspective about, oh, well, you can ask for this, but this is what they're going to think, or how you approach their perspective as well. So I wouldn't say it's that important to get a specific attorney with specific plastic surgery experience, although that's nice, but somebody with experience with physician contracts in general is absolutely important.
Okay, perfect. Thank you so much. And also, I am applying for fellowship this fall. I still have fifth year and then sixth year. What would be a good time to actually start the search? When is too early? I spoke to a private practice earlier in the year, and she's like, it's a little too early, but we are excited to speak with you in the future. So what do you think is a kind of a good timeline? Granted, I had the limiting factor of wanting to end up in Arizona, so that would be my geographic limitation.
So it's never too early to start putting out feelers. So the one thing I tell folks is you're absolutely right. If you're looking at a particular area, practice, you can always reach out to the different groups, departments, universities, hospitals, what have you, and say, hey, I'm interested in this. There's nothing wrong with that. Now, until you start getting closer, typically about a year out, you're not going to have, in-depth contract negotiations, visits, and things like that. But it doesn't hurt anything, and to make sure that you make some of those contacts. If for nothing else, then you begin to put the idea in their mind that perhaps they need another surgeon, in particular you, to come and fulfill the needs of their patients.
Okay, great. Thank you, guys.
I would echo that. I don't think it's ever too early to begin asking questions and putting out feelers. There's I think the year out is probably the practical timeline, because the other thing is a lot of places are not going to know when they're going to have funding available for positions to hire people. But particularly in your case, since you have a geographic restriction, I think earlier is better, so that they get to know you, that you're interested. And so when a position happens to become available, oh yeah, by the way, that Dr. Turner was looking for a job 6 months ago. So I think it's never too early, particularly if you have some limitations like that.
Okay, thank you.
Dr. Bhavaraju, we have in the chat from Dr. Polkari, what is the best way to actually approach negotiations? Is this generally done through email or phone calls? How do you suggest opening that conversation after you receive a contract? And are we negotiating with division chiefs or with HR? Dr. Smith, if you want to.
So both. So one of the things I tell folks is that you're going to be talking with the chair/division chief for a lot of the things around, I call them as the letter of intent ideas. They're the big picture ideas around the contract, how much you're going to make, what's your call coverage, all of those things that Avi has put out there earlier. That's going to be really in person. And that's one of the things, that I tell you is why I didn't make slides, is you're not going to have a piece of paper in general in front of you when you start asking for those things. So you need to make sure that you understand fundamentally what's important to you, and two, what you look like within the market themselves. Now, what'll eventually happen is, you're going to get your letter of intent, which will give you kind of an outline of the overall ideas for the job. Then you're going to start to see something, a true contract. And you'll know the difference because the letter of intent, I always tell people, is typically the appendix A of the contract. The contract is going to be about 16 to 20 pages long, filled with a lot of legal jargon. That's very different. And those are different negotiations that are occurring in different areas and different places. And you've got more or less ability to negotiate the things within those two documents, depending on what you're joining or how you're joining. So, for example, if you're coming to work for me, for example, U of L Health, I've got 14,000 employees, 1,400 surgeons and physicians. When we get to the point of the contract, while I have a little bit of language within the contract itself, for the most part, I'm not going to be making massive changes to the contract itself because I don't want to create inequities within my own physician practice. And so that's one of the things. The second thing I will say is that a lot of negotiations, back and forth, there's a lot of leeway in a lot of those things. And again, I think that it becomes, if I am giving up something, what am I getting? If I'm getting something, what am I giving up? So that we all come to a good offer. When I'm sitting there, for example, when I was in a division chief role, if I was in a division chief role, my job is to, one, provide you with the best opportunity to take off in my division, but also I can't completely reset the value of every one of my other surgeons within the division by, trying to renegotiate your contract individually. So there's always constraints, and understanding, what you are and what they are important in going back and forth in those negotiations.
Any other questions, concerns, anything else we can address for anyone?
Yeah, I have a quick question. So if you are reaching out to a program and sort of cold emailing them because they're sort of within an area that you're looking to get a job, who is the person that we should be emailing for that?
So typically, you're going to send that to the division chief. If it's an academic job. If it's not an academic job, you're going to want to one of two ways. You can send it through HR, or if they have, for example, most hospitals will still have a chief of surgery, even if they're not an academic. That's somebody who acts as the physician advocate for surgery along those lines. That would be another person that you could send a cold email to. We get them all the time. I mean, I get them for now physicians all over the entire practice themselves. And just say, hey, I'm looking, I'm interested, I'm thinking about this, or my family's in town. We keep all of them. I forward them to HR. We keep them within the division. So if it's a cardiologist, for example, that sends it looking for a job here at U of O Health, they may send it to me. When I was a CMO of the healthcare system, I'm now the CEO of the healthcare system, but I would provide it to them and say, hey, someone's looking. Keep that in mind as we go through strategic decisions in the upcoming year. It's not uncommon, and it's good to do.
And then just as a follow-up to that, what should be included in that email? Like in my mind, that should be like a relatively short email, like with my CV on it, just as like a, hey, this is what I'm interested in, without a lot of detail.
Yeah.
Would
The
that be
letter-
pretty
the letter of
reasonable and
interest,
sort of
right?
allow the program to follow up with us?
Remember that letter of interest Dr. Khariton talked about? That's where that letter of interest comes into
Yep.
play.
Absolutely. And he did a great job of explaining that. I mean, it's who are you? Why am I emailing this person? Like, why is this job important to me? And this is who I am, right? So that's what you're looking for in that.
And I agree with Dr. Smith. On the academic side, it's probably going to be the division chief. If it's a non-academic job, let's say it's a private practice, then a senior partner in the group. Like sometimes it is, we said cold calling, like it's not as easy as it sounds, trying to figure out who that person is. In the academic infrastructure, it's going to be the division chief, but outside of that, it's not always that easy. If you can find the lead physician, the senior partner in a group, or the TMD in, let's say, a private employee job, or this is where contacts and personal references can oftentimes help. Like if you're looking at a particular geographic region, if it's the area where you are, ask your PD or some of your faculty, hey, do you know Dr. So-and-so, or do you know who the division chief is, or the TMD at this place, can oftentimes help. The HR thing, I will just tell you my experience that if you have no other way to go, that's probably the people to reach out to. But the HR route tends to end up being a black hole. And you'll send stuff to HR and you will never ever hear anything back. So that's, that slide where it was like, be prepared to be frustrated. That kind of came from my own experience applying for jobs through HR links because you can't find anybody specifically and they end up going to a black box. So that's all you have, then that's reasonable. Just don't expect to hear anything back relatively quickly or maybe even at all if you go the HR route.
Only little thing I will add is if you're emailing, if you reach anybody in a private group, everybody in the group talks. If they get an email, they'll forward it to the appropriate person.
So I think that's where the networking piece really becomes a big part of this. And I think, and correct me if you feel differently, Dr. Smith, I think that's changed a lot in the last 3 to 5 years. Like when I was coming out, it was almost all networking, personal connections. I mean, there was cold emailing involved, but that was always with a follow-up from a program director or a faculty member. Now, the last time I did a job search, I mean, virtually every job I applied for was through some online link or website that went through HR. There was a lot less personal interaction and it makes things challenging for you guys on the applicant side. But that's just the reality of where things are now. So I just say that qualifier to you about the be prepared to be frustrated piece because it's reality. And if you can somehow find a personal connection or route to go, it's always better, but it's harder to do that these days.
Thank you, guys.
You're welcome.
Thank you so much for this presentation. It was super informative. I'm just wondering, is there a way to get a copy of the slides or the recording? I might have missed it if you mentioned it already.
Yeah, so all these sessions will be recorded and they'll be available on the website. I don't have the timeline for those yet, but as soon as we get them, we'll post them to the website and we'll send a blast email out. But I'm also happy if I'll have all my contact information on the last slide, and you guys can email me. I'm happy to send you the presentations if you want. But all these sessions should be recorded and available for consumption later on at some point. We're still working on getting the links together.
Great, thank you so much.
And we recognize it's a lot of information, and for time constraints, I tend to be a fast talker anyway. I was trying to get all that stuff in, and it's hard to keep track of it all. But I just, at least, if nothing else, we just want you guys to hear these things, right? It's important to what you don't know, you don't know. If you start hearing these things and realizing that there's a lot of things out there that makes the job search much more complicated than just, oh, I want to go to University X, and yeah, I'll be a trauma surgeon. Sure, it's a lot more complicated than that. And so at least hear this and hear it over and over again and start, hopefully we push the needle in terms of the advocacy piece and the education piece so that when you're out there, because at the end of the day, this really comes, like I said this a couple of times, the whole goal behind this, like when I came out, there was a statistic that 70% of general surgeons changed over their first job in 3 years. And in my experience, I think that's because of expectation mismanagement. And a lot of that comes from lack of knowledge and not knowing what to ask or knowing what the situations are. So then you walk into a job not realizing these things, and then all of a sudden a year in or 3 years in or 10 years in, something comes up and you didn't realize, oh, I didn't know about this. So that's where this all kind of stemmed from is, a lot of our own personal experiences and hoping to fill those gaps of knowledge so that when you go into a job and you take a job, you've minimized as much expectation mismanagement as possible so that it ultimately leads to better job satisfaction and long-term retention. So you don't have to change over jobs. That really was my ultimate goal for this.
Hi, I'm Elisa, current surgical critical care fellow. You were talking earlier about, when we start to bring up the concept and the subject of salary, you might not want to do that right away. On that same note, for those of us who may need visas, especially in this touchy situation, is this something that's better to be upfront earlier versus a little later? Are there any other hurdles that we should expect other than, some place that might not accept visas, or are there any other resources or what?
Yeah, no, great question. So this is something that comes up often. We don't talk about it quite enough. So a couple quick things. One is know what kind of visas you're looking for / eligible for. And that's, it's difficult to do that on large basis for every single person, but you need to know what situation you're in, and you should know that. If there are areas, and like I said, if you're converting J1 visas, which is a very, very common one that we have, there's always places that we can work in medically underserved areas that help fulfill the requirements for those conversions from the J1 visas into others, H1 and the like. Be upfront, because a lot of times we can work with you and have the ability to work with folks in order to, one, get to the exemptions, and it works for us, it works for you, happy to do it. The other thing too is as you're looking through, some of the other visas and working on those timelines, there's actually a lot of legal work that we do within our own practice that we can help provide. And a lot of times, if we're willing to bring you on, we're also willing to help support that, and figure out ways that we can help work through the process a little easier, better, and faster for you, because we do this, it's a one-time thing for you. I'll be honest, at any given time, we're working through about 40 or 50 of these across the healthcare system where we're working on visas for whatever reason for folks. So there are resources available, particularly at larger healthcare organizations, to be able to do this. And if we're willing to hire you, we're also willing to accommodate you and trying to find ways to make that work. So be upfront, talk to folks. The sooner, the better. And the reason I always say this is that this time of year, if I'm working and trying to get someone with visas for 2026, they need to have contracts, not letters of intent. They need to have a contract signed in hand by, for example, September 1st. So we're working through a lot of those right now across the healthcare organization. And so your timelines and our timelines need to be aligned in some of those things.
I would 100% agree with that. It's never too soon. If there are any things that you anticipate that might make the job process take longer or be challenging, it's better for you and for them to know that on the front end, rather than you get all the way down, you've had all these great conversations, you've got a contract in hand, and then all of a sudden you're like, oh, I have a visa problem. It's going to, honestly, it'll piss them off. Like, why didn't you tell us this sooner? Right. And at the end of the day, it's going to make things easier for you too, because if there's a bunch of places, you got 5 places that you've loved, and 3 of them are not going to be able to sponsor visas. Honestly, why waste your time and effort? Even if you love the programs, if it's just not doable because they don't offer those visas, why bother? Why waste your time and efforts and energy? So I really think it's important to be upfront about that. And as Dr. Smith said, a lot of these institutions like UAMS, where I was for 7 years, had a very robust department specifically dealing with visas, because they have so many people that had that difficulty, so they can help. And again, hiring your own immigration attorney certainly can be beneficial, but institutions have a lot more resources than you do, and they have very well developed systems and people in place to help with that.
Yeah. So everyone, I apologize. I'm going to have to step away. I want to thank you all for asking me to be here and answer questions. I put my email in. I would be happy to help any of you all out if there's any answers or questions I can answer for this. I'm going to go welcome 60 of our new physicians that are starting. They get football jerseys with their names on the back of them, and I've got to go shake hands and pat backs tonight. The last thing I will say is, this can be somewhat stressful for folks because it's the first time that you've really had to negotiate and make choices. Up until this point, you were kind of taking what you were given and liked it, as Avi said. Don't let it weigh you down, because this should be, 1, rewarding, and 2, fun. You're getting to the point in your career where you're going to make money, and making money is okay. I remind folks that every single day. And 2, when you get there, enjoy the process and getting to start and do something new. And I hope you all go to welcoming environments that help support you and grow your practice.
Thank you, Dr. Smith.
Take care, everybody.
Thank you, Dr. Smith.
We still got a few minutes left, so I'm happy to hang around if anyone's got any more questions, concerns. And again, this is an open forum, no judgment environment. There is no such thing as a stupid or simple question. Like we have been there where you are. We have struggled with the same things that you're thinking about, the same things that you're struggling about. So feel free to ask. And if there's no other questions, that's okay. But we're here to help be a resource for you to navigate this path and to lessen your fear and anxiety, if we can.
I have a quick question.
Sure.
So, as someone who probably wants to stay more academic, doing all three trauma critical care, ACS, if you're not able to get that job initially, especially with geographic constraints, is there a better work can then jump back into that field? Like if you get a straight general surgery job, does that sort of bar you out from coming back to academics? Is it better to go level 2, level 3?
That's a great question. What I will tell you is this. I had a similar situation. So my first job out was straight private. I was employed by a hospital, no academics, no teaching, no nothing. It was a great job. I enjoyed it. I had great partners, but after about 3 years, I realized that I just wasn't fulfilled, and I'm not necessarily academic in the sense of research, but I enjoyed teaching, and I had this perception that, oh, well, it's impossible. You can't go back into academics. I think that's a false narrative in the sense that what are we qualifying as academic? Like, so there's a lot of variations in what an academic physician is, right? So we did this a bit in the first session, but just to kind of pare it down, don't think of academic as just university based. Within academic, yes, there's university programs, but there's also programs like where I trained. It's a community hospital with a GME program. So what are you qualifying as academic? If you're interested in teaching and being involved in educational stuff and doing all the clinical things, then yeah, you can still be an academic physician. Like, for example, with Dr. Khariton right now, like it's not a university-based hospital, right? But they have a GME program. So again, that introspective, like what is academic to you? And then realizing that there may be other opportunities than what you're just realizing, oh, I have to be at Hopkins, or I have to be at Mayo, or I have to be at, shock trauma. Now, so I would think in general terms, even if you're out of academics, yes, you can get back into an academic environment, even having been out of it. Having said that, yeah, if your goal is to be at the name and fame places, the Vanderbilts of the world, the Emorys of the world, the shock traumas of the world, then yeah, you probably should try to focus on staying within that environment. It's not that it's impossible to go back in, but because of their own perceptions and their own biases, it may make that process more challenging. But at the end of the day, it comes back to what is going to make you happy. It doesn't just, is it university based and like the big name and fame kind of thing? Or is it that you want to be a good clinical surgeon and teach residents and fellows? Or are you research focused? If you're research focused, then you probably need to be in the university camp. So long-winded answer, but I think being out of academics doesn't necessarily mean you can't go back into it. I'm living proof of that. I left that job after 3 years. I went to the University of Arkansas and I was there for 7 years and I became an academic surgeon, right? So there are ways to do that. It kind of depends on what you want and how you frame the question. Hopefully I answered that for you.
Yeah, that was really helpful.
And honestly, if you have a specific situation, like you can call me and I'm happy to chat with it about you. Like this is a very nuanced discussion, right? And again, there's no black and white answer. This is not evidence-based. This is all anecdotal. But I think between our collective experiences, we've been through enough that I think we can give you reasonable guidance to help you make a more informed decision. But I think a lot of this comes from perception or misperception about, well, if you're not in academics, you can't go back to academics. Well, that's a certain mindset, right? The Hopkins of the world people, oh, if you're not at some big university, you can't go back. Well, yeah, do you really want to be at a university program, or is it just that you want to be involved in teaching? There are other pathways that can get you back into that. That's not going to fight those biases.
I'm just going to add 2 quick points. I think a lot of the things that we just said are really important. I think the important thing is to ask yourself what in academics you're looking for. There's certain things that you cannot obtain outside of major centers, and if those things are the things that are important, the big bench research, just things that require a lot of academic resources, then it's a different situation. If you're confined to a geographic area and there's no jobs available at that center, it's hard to get back into academics after a period of time. Obviously, if you take a job while waiting for a job to open up in a geographic area, that's okay. take a job that will allow you to do the things you want to do that's closest, and be mindful of your contracts that allow you to leave once a job opens up. So just be careful about the restriction clause. What is it called?
Yeah, that's a big thing for your scenario. Like the non-compete's a big deal, right? So this is where the nuanced things about I mentioned about main facility versus any facility that you work at versus any facility in the system. Like in your situation, like the dream job is not available, so you take a job at a competing hospital 10 miles down the road. Well, the nitty-gritty for your situation is going to come down to what's the non-compete say? Because I'm telling you, like my best friend, from 1 year to the next, the contract changed, and it went from facility where he's working to any facility in the hospital system. And that basically X'd out the entire Atlanta market. And luckily, he looked at the contract and he caught it. And so he called him on it and it got changed. But if he hadn't, that would have X'd him out of the entire Atlanta area, which is a massive area. So, and I'm not saying I'm not saying, like, I don't want you guys to think the hospital systems are trying to trick you. No, but the fact of the matter is, they're not going to do anything that's in your best interest. They're going to do what's in their best interest. Now, that is a very prohibitive policy, but there are places doing this kind of thing. So I think every situation is different. In your scenario, I think it's reasonable to take a job to stay to meet your geographic need. But if you were going to take a job and you had to pick one versus the other, I would say it would probably be better to be involved in some, if you really want to be academic, be somewhere where you're engaged in some academic endeavor, whether it's teaching, whether it's research, some area that gives you that experience so that you can say, oh yeah, I'm you're not completely out of academics and going back. I would just took a different pathway. I'm still actively engaged in, because if there's a GME program, there's going to have to be some research involved, right? Now, if you're really a bench researcher doing basic science stuff, yeah, you probably need to be at the university program. But if you're at a clinical hybrid program, you can do clinical research and check those boxes and set your academic portfolio up so that when you do apply to the academic university job, they can show that you still had some meaningful productivity and done things to check those boxes, even though you've not been in the university environment.
The other thing to do is, before you take some other job, it's worth reaching out to the institution that you really want to be at and tell them your story and why you're interested and that you're very interested, because sometimes there's jobs that are not advertised that they know are heading to fruition in the future. They have a disgruntled, member they know is looking to leave. They know they need to expand. That's just not advertised yet. So reach out to see if an opportunity will present itself before while you're looking for other things.
This is a big point. I think it rolls back to the cold calling thing. A lot of times institutions are looking to make changes, looking to make moves or expand their number of people, but funding for the positions becomes a big issue. So at one of my previous jobs, we were really shorthanded. We knew we were going to hire people, but the funding hadn't come through yet. And so we couldn't officially post a job. But let's say in that scenario, you have no idea what they're looking about, what they're thinking about. So reaching out early and saying, hey, this is me, this is what I'm interested in, I'd like to be in the area, it puts you on their radar so that when and if the funding comes through and the position's available, you're going to be one of the first people they think about. So I think there's absolutely value in doing that cold call thing where you send the letter of interest. Now, it has to be appropriately professional, like good written letter of interest, have your CV organized, but that it puts you on their radar, even if there's not a position available, so that when it becomes available, it puts you already in the driver's seat to potentially be in that role.
Thank you.
You're welcome. Any other questions, concerns, any other thoughts, or even any commentary? I mean, I honestly, genuinely, I'm asking, this whole process, this course has really been a lot of effort on a lot of people's part, but it's kind of been an idea or brainchild of mine for about the last 10 years that I never really had the opportunity to put together without the resources of East. And based on my own experiences and having done this on a lot of one-off bases, I think there is a need for this. But I really genuinely am asking you guys, because you are the target audience, do you see value in this? Do you think there is a need for this? Are we filling a need that you guys either didn't realize or maybe now are realizing is there? Do you find it beneficial? it's good to hear that you have a vote of confidence from you, Dr. Bernard.
This is great. It's very comprehensive. Great stuff.
And again, this is the only session two. The session one was a little bit more of the basics. I said, like I said, business of acute care surgery, billing and coding, a little bit of the practice types. We will have that link available soon. This one also will be available for consumption later on the line. And then again, this is not by any means entirely meant to be comprehensive. We really struggled a lot with trying to condense all the material down to 4 sessions with the really high value stuff. And so that's why we broke it up into 4. There's a lot of other stuff we could be talking about, but felt like this is the most important stuff. So session 3 will sort of talk about all the kind of insurance 101, because there's so much about the insurance process that really I didn't really even understand when I came out, like understanding what whole life insurance is versus term life insurance, like what are all these things. So we're kind of setting the foundation. It's iterative. So understanding job structure, understanding the business of medicine, understanding how to approach the job search, contracts. So then in the next section, we'll kind of go into some of the more side things that are really still very important about protecting yourself. Like disability insurance is a big one, right? As high income earners, professionals where your cognitive abilities and your hands, for you, it's much more important. Like having disability insurance is really important, because if you walk out tomorrow and get hit by a car, which could happen to any of us, and you're not able to get back to work, how do you protect yourself and your family moving forward, right? And this is a topic I knew nothing about when I came out of training, right? So we're trying to distill all this down to high value stuff. And so I really hopefully encourage you guys to come to sessions 3 and 4 later on in the year. But as I said, I am biased. I think there is value in this. This is all the stuff that you're hearing is stuff I wish I had heard 10 years ago or 13 years ago. But at the end of the day, I hope that you guys found value in this, and please provide us that feedback, good and bad. If you don't think it's helpful, please let us know. If it is, same. And by all means, please spread the word to your colleagues, your co-residents, your fellows, even outside of surgery. This is an open, free process. Anybody is okay to register. I see Justin Ellenberg is one of my fellows at Emory as an anesthesia or ED critical care fellow, and he's here. So I'm glad to see it's open to anybody, right? It's not just for surgery people. It's not just for trauma. Please feel free to spread the word.
Hi, this is Annie Polgari again. I have one more question.
Yeah, please.
And sorry, so this is funny just because I just had a baby, so I'm starting fellowship a little late. But I'm curious, like maybe you guys mentioned this, the timeline for when we should ultimately try to have a contract signed by for our first job. Because I know at a certain point it probably becomes like a little bit too late if you wait too long or talking to multiple places and struggling to make a decision. So I'm curious what you think that timeline should be.
It's a great question, and and I maybe am a little bit in the minority in this. I would tell you that I don't actually think there's ever too late a time, because at the end of the day, it comes down to finding a good fit for you and there's the ethereal, what's a good job, but there's also the practical timeline, which actually comes down to money, right? At the end of the day, there's 2 different competing factors. What I would say, if you're on the typical timeline, right, if you're getting into, let's say, April, May, into June, you should really ideally have something finalized from a practical standpoint, because particularly if you're going to a different state, looking at licensing issues, looking at credentialing issues, most of the time it's going to take 60 to 90 days, right? So if you have to, if you force me to pick a time, I would say really by the end of May or beginning of June is really the latest you should consider doing this. But at the end of the day, I'm also going to tell you, I mentioned, right, you're never going to have this kind of freedom ever again in your life, right? Taking time off to recuperate, relax, and decompress, I'm going to tell you, is a far more important thing than signing on the dotted line by A, B, C, X, Y, Z amount of time. It really comes down to practical issues about getting a license and credentialing, and then more importantly, money, right? Because at the end of the day, can you pay the bills? Right. If you've got enough savings and you've been smart and you can take the entire summer off and not working until October, do it. That would be my strong advice. Now, if you don't, and from a practical standpoint, you need a paycheck, then working backwards from, you can consider starting, like right now, fellowship's finished end of August. So let's say September 1, you're basically free. Then you say, let's say, start October 1st. Working backwards from that, 60 to 90 days, you're kind of into that June timeline, right? So I would say that's probably at that point you really need to want to make a decision just from a practical standpoint.
I'll add two small things because we've been dealing with this from a hiring standpoint on the other side of things. One, there's great resources in the chat. I see Mark Tucker put a few things in as far as the states that have the longest licenses. The licensing thing is a problem, and the finance thing that obviously Avi mentioned. Do you have the money to have some time off? There's usually 2 interview cycles, early and kind of early spring for early fall for everybody in fellowship who are like, I know exactly what I want. Let me look for those jobs. And then second round is people as jobs basically get their end of beginning of year salary lines and more jobs become available. I think it really comes down to don't sweat the contract. If you have the offer, you'll be okay. Some places will take longer getting the administrative side, but once they need you as much as you need them. So as long as you have an offer and the place fits what you need in your life, the exact time that the contract is going to happen isn't the end of the world. Make sure that the people you're dealing with are actual trustworthy people. But most of the time, that's not that big of a deal. And just be mindful of whether you have the finances, if there is a little bit of a delay, and the time it takes to actually get the credentialing done.
Yeah, to Mark's point, Texas, California, Florida, particularly California, I've heard horror stories. I had a friend that took 12 months to get his license to go through. So that and credentialing are really rate limiting steps. That and the finances. So it depends on your unique situation. But I think, end of May to first week of June is probably a reasonable timeline to make sure you're protecting yourself in terms of getting through those things. But, to Dr. Khariton's point, if they want you, you've got a contract working, they're going to work with you and they know you want you, then I wouldn't worry too much about exactly the time frame. But a lot of it comes down to your individual situation and financial stuff. Like if you got some savings, then I wouldn't be as concerned about it. All right. Well, I think we're coming up on the time close. So just as a kind of a brief to end things up, I'll just kind of show you this. So our next sessions, as I mentioned, session 3 will be in September, October. Once we have a final date, we'll push that out. It'll be all the insurance topics. And then session 4, we're going to talk about retirement financial planning, and then how to handle adverse events. I think this will be an interesting topic to discuss. It's not something I initially thought about including, but I think after our discussions about planning through this, I think it's an important thing to talk about is when you have one of these things happen, how do you approach it? I think this will be one of the things that distinguishes this from other similar offerings. And then again, session 1 and 2 will be recorded. They're all recorded. We'll have the links available soon. So just stay tuned for those. But you've gotten all of our emails. If you want the slides, happy to send it to you. Mine in particular is very big because of all the animations. I'll probably upload it to a Google Drive and share it with you, but we're happy to do that. If you have any questions, any concerns, any help, my email's there, my cell phone's there. And I say this and I mean it. You can call me, you can text me, you can email me anytime, 24/7, 365. Hopefully you've seen that this is something I care deeply about and I'm very passionate about, and you will never, ever be bothering me. I think I had one fellow from the first session email me and ask me about contract stuff, and I put him in contact with the guy that reviewed my contract, and he found it very helpful. Not that I'm saying you have to, but I want you to know that a big component to this, it's easy for us to say, do this, do this, do this, do that, but then don't provide you resources for how to actually do it. And I very much want to close the loop on that. So if there's things that we can do to help you as you move forward, like I say, okay, go find a contract attorney. We don't have anybody. Okay, let us know. We'll put you in contact with somebody, or giving you the online resources, or you just want to talk through a situation. Can I ask this question? Can I ask that question? Like I did that at the East networking event last year. At the table I was at, we just sort of walked through, well, how do I ask about this? How do I ask about that? And even if it's something simple like that, feel free to reach out anytime. I'm not saying everybody else is available 24/7, 365, but I certainly am. So we're here to help. And if there's anything we can do, please feel free. Don't hesitate to reach out. And we hope that you'll all come to sessions 3 and 4. Watch out for those emails, blasts from East. And as I say, when you get them, feel free to forward them to any of your colleagues, even outside of surgery and trauma. It's open to anybody and it's free. But thank you all for attending, and we really appreciate your involvement, and hope to see you at the next session.
Thank you, everybody.
Thank you.